We got a problem here in Mecklenburg County, and it's called a syphilis tsunami.
Whistleblowers alerting the public to a growing syphilis crisis. And new tonight, new information from state health officials confirming just how bad this problem is, announcing 5 newborns have died from congenital syphilis.
The new information comes as the CDS says cases of mothers and their unborn babies contracting syphilis are at crisis level. Just look, cases are up 10 times in the last decade. WBTV investigative reporter David Hodges has been investigating this problem for months. He's been talking with whistleblowers who worked at the Mecklenburg County Health Department who say they decided to speak out to warn the public.
As I kept saying, women are going to start getting it. Babies are going to start getting it. And this is what we're seeing now.
Yeah, David joins us now to explain the heartbreaking spike really in cases. David, the CDC, again, we said that calling this a crisis.
Yeah, and when something increases by 1,000% over a decade, you have to label it a crisis. That's just how big the jump has been when the amount of newborns has risen by that much. And the NCDHHS today announced that it was a public health alert while saying that 5 stillbirths already this year, also neonatal deaths, so that's 5 in total. That's more than the state reported in the last 5 years combined. I'm digging deeper into North Carolina's numbers. Because of that dramatic spike in claims from former health workers, the problem has been growing for years. The CDC reports nationwide there were more than 3,700 reported congenital syphilis cases last year, most of those completely preventable. The same year, North Carolina reported just 57 cases, which would be just a little more than 1% of all the cases nationwide. I'm continuing to investigate problems the state and county had tracking and treating syphilis, but the most important message for this moment is that pregnant women should be getting tested by their doctors and treated, and that is a thing that the healthcare providers as well as county, state health leaders need to be advocating for, and they are right now.
Okay, CDC certainly advocating for it, and you are passing it on to us. David Hodges live tonight.
David, thank you.
Welcome.